Let's take a look at medications that can cause symptoms similar to Parkinson's disease. In some cases, simply stopping or switching a few medications you are taking may be enough to treat the symptoms. However, there are cases where symptoms do not improve even after discontinuing the medication. In this video, we'll take a look at medications that are commonly prescribed or taken, which can cause symptoms similar to Parkinson's disease. Parkinsonian symptoms caused by medications like these are called secondary Parkinsonism, or more specifically, drug-induced Parkinsonism. The terminology might not be very easy to understand. So, I'll briefly organize the diagnostic terms related to Parkinson's, and then we'll also take a closer look at drug-induced Parkinsonism. The diagnosis of Parkinsonism or Parkinson's syndrome is, broadly speaking, a concept that includes the four diagnoses I'll explain now. The first is Parkinson's disease. It's called idiopathic Parkinson's disease, and it's the most common type of Parkinsonism. You can think of about 80% of all Parkinsonism cases as being Parkinson's disease. Next, there is atypical Parkinsonism. In other words, it's also called Parkinson plus syndrome, which refers to degenerative neurological diseases that show symptoms similar to Parkinson's disease, but with additional symptoms observed as well. In short, these are subdiagnoses that have a wider range of symptoms and are generally worse than Parkinson's disease. There are also several diseases classified as Parkinson plus syndromes. Although these are difficult terms, they include progressive supranuclear palsy, multiple system atrophy, corticobasal degeneration, and Lewy body dementia. The reason for distinguishing each of these is because there are differences in their clinical symptoms. However, even so, the treatment does not change based on these distinctions, so in some ways, it makes me wonder if this is just a rather futile academic discussion. In any case, Parkinson plus syndrome is certainly a nasty condition. Not only does it respond poorly to dopaminergic agents that are effective in Parkinson's disease and have a worse prognosis, but it also shortens survival time. The third type is hereditary degenerative Parkinsonism. It has been reported that the proportion of Parkinson's cases caused by genetic factors ranges from as low as 5% to as high as 10%. The fourth type is secondary Parkinsonism. In other words, this refers to Parkinsonism caused by other factors, such as drug-induced Parkinsonism, toxic substances, trauma, cerebrovascular disease, normal pressure hydrocephalus, as well as central nervous system infections or tumors. Drug-induced Parkinsonism, which is the topic I'm discussing today, also falls under the fourth type, secondary Parkinsonism. Now, I will introduce some of the medications that can cause Parkinsonism or Parkinsonian syndromes. However, you might be surprised to learn that these medications are not rarely prescribed drugs, but rather ones that are prescribed very frequently and taken by many people. Of course, taking these medications does not mean that everyone will develop Parkinson's disease. Since Parkinson's disease tends to occur more easily in people with genetic factors or predispositions, there is no need to worry excessively just because you learn about these medications. It would be best to simply keep in mind that the medication you are taking could potentially cause or worsen Parkinsonian symptoms. The most representative medication is, first of all, gastrointestinal drugs. This medication is called metoclopramide. There is also a drug called macperan. Additionally, medications that help with gastrointestinal motility, such as levosulpiride or clevosulpiride, are representative examples. The second category is psychiatric medications. There are antidepressants and antipsychotic drugs, such as haloperidol, lithium, phenothiazine, risperidone, and olanzapine. Third, there are also medications for migraines and dizziness. These are commonly prescribed when people visit neurology, ENT, or family medicine clinics due to headaches or dizziness. Examples include flunarizine and cinnarizine. It's good to be aware that these medications can also cause Parkinson's symptoms. Among the medications used to treat headaches, the anticonvulsant valproate or valproic acid is also classified as a drug that can induce Parkinsonism. In addition, there are also medications for angina. Medications such as trimetazidine and kilostazol, which are used to treat angina, can sometimes cause symptoms similar to Parkinsonism. So please keep this in mind, and if you are taking any of these medications and start to experience symptoms similar to Parkinson's disease, it would be a good idea to consult a specialist. Drug-induced Parkinsonism, which is a representative form of secondary Parkinsonism, is in fact very unlikely to be actual Parkinson's disease. If, after taking medication for indigestion or constipation in internal medicine, or for migraines, dizziness, depression, or psychiatric disorders in neurology or psychiatry, you develop symptoms of Parkinson's disease such as slowed movements, tremors, or loss of facial expression, it is worth considering the possibility at least once. You may be curious about when drug-induced Parkinsonism appears after taking the medications I mentioned earlier. Generally, about 50 to 70% of cases develop within 1 month after exposure to those medications I mentioned earlier. It is said that about 90% of cases appear within 3 months. So if these symptoms appear within about 3 months, you can consider the possibility that it might be drug-induced Parkinsonism. Therefore, this is a fundamental aspect that should be considered when diagnosing and treating Parkinson's disease. In other words, if someone develops Parkinson's-like symptoms as a result of taking medication for unrelated internal medicine, psychiatric, or neurological conditions, being aware of and able to identify this situation means that instead of treating Parkinson's disease, which has no definitive cure, you might be able to resolve the symptoms simply by stopping or switching some of the medications being taken. Therefore, being aware of this can help prevent situations where a small problem that could have been easily managed ends up becoming something much more serious and unmanageable. So, it's important to keep this in mind. In fact, in my own outpatient clinic, I often see patients over the age of 60 who develop symptoms like headaches, dizziness, or depression. They visit multiple hospitals and take various medications, but their symptoms don't improve. According to their caregivers, the patients sometimes seem to act strangely. In such cases, I think it's worth suspecting that this might be drug-induced Parkinsonism. With drug-induced Parkinsonism, most of the symptoms seen in Parkinson's disease can also appear. However, if you look closely, there are clinical differences between the two. Typically in Parkinson's disease, stiffness or tremors are often more severe on one side of the body. On the other hand, in drug-induced Parkinsonism, tremors tend to appear symmetrically on both sides rather than just one. There are also differences in the type of tremor. In Parkinson's disease, tremors can occur when the person is at rest. In contrast with drug-induced Parkinsonism, tremors often occur when changing posture, known as postural tremors, and these tremors tend to be smaller in amplitude and faster. While Parkinson's disease causes tremors like this, drug-induced Parkinsonism is characterized by faster, smaller amplitude tremors on both sides, resembling essential tremor. Also, while symptoms of Parkinson's disease are more common on one side of the body, reports indicate that in drug-induced cases, symptoms are often bilateral and more severe in the upper body. You might then wonder if you stop taking these medications, when drug-induced Parkinsonism will start to improve. In cases of drug-induced Parkinsonism, if the medication is discontinued, symptoms related to Parkinsonism often improve within as little as 1 to 2 weeks or up to about 3 months at the longest. However, even among patients with drug-induced Parkinsonism, there are cases where symptoms do not improve despite stopping the medication. In a related study, dopamine PET scans were performed on patients with drug-induced Parkinsonism, and it was reported that about 10 to 30% of them had reduced dopamine function. In other words, for patients whose symptoms do not improve even after stopping the medication, it may not simply be drug-induced Parkinsonism caused by side effects, but in some cases they could actually be in the early stages of progressing Parkinson's disease. And it seems more reasonable to view this as the actual progression speed of their underlying Parkinson's disease being accelerated by the medication. In this video, I explained drug-induced Parkinsonism, which is a type of secondary Parkinsonism. In reality, many patients tend to overlook drug-induced Parkinsonism because they think, surely not, since the medication was prescribed at the hospital. In fact, it seems that even the doctors who prescribe these medications are often not very interested or are not well aware of this issue. Through this video, I hope you can take a moment to be reminded of the commonly used medications I mentioned that can worsen Parkinsonism symptoms. If you experience any of the Parkinsonism symptoms I mentioned earlier after taking medication, I hope this serves as an opportunity for you to consider whether these symptoms might be caused by the medication and to consult a specialist about it.